Welcome to 5 Questions with Linda and Maureen. Today's topic is ACT, Audible Contrast Threshold Test from Interacoustics. Just let's start with the first question. Maureen, what is ACT?
Well, ACT is a new diagnostic test that goes beyond the audiogram and addresses the number one challenge among most people with hearing loss: difficulty understanding speech in noisy situations. The audible contrast threshold actually predicts your patient's aided speech and noise ability and provides a baseline for counseling. The ACT test is really quick to perform under earphones in your clinic. It's actually a binaural test, and it can objectively measure your client's hearing and noise ability, all in less than 3 minutes. If you know how to do an audiogram, you can perform ACT. But instead of hearing a pure tone, the client will have to be listening for a very unique siren stimulus. It's actually a spectrotemporal modulation, and that's presented inside of pink noise. It's the background noise. So whenever the client hears the target sound, they have to press the button. So it's a little bit more difficult than an audiogram. The ACT value that you'll get is reliable and unique to each patient. A higher ACT value means that your client will require more support from the hearing aid to help them hear better in noise. And the combination of your client's needs, of course, their audiogram, and this personalized ACT value can directly support your hearing aid recommendation for your client. Okay, question number 2 for you, Linda. Who is and who isn't a candidate for ACT?
Okay, who is? Every person who can participate in an audiogram is a candidate for completing the ACT test because the test doesn't use a language-based speech signal. It can be used with almost any patient or client. The test is performed similarly to a threshold test or an audiogram and requires a quiet space. It does take a little more concentration on the part of for the patient to hear the target signal compared to the background signal. Who isn't a candidate? Okay, now we have the ACT test is not recommended for a few clients group. First, children. The test has not been validated in children. Patients with severe to profound hearing losses, patients with hyperacusis or severe tinnitus due to sensitivity, sound sensitivity, and people who have cognitive issues because they need to concentrate. But we have a special group, people with unilateral and asymmetrical hearing losses. We spoke with Interacoustics and they confirmed the test can also be performed for these patients. That's because the ACT is designed to reflect a real-world response of the patient's ability to hear in noise. Also because the test software uses the patient's audiogram, the presentation levels are adjusted for the difference between ears. Next question for you, Maureen. Why should our customer consider adding ACT to their test procedures?
Well, today we fit hearing technology based just on the audiogram, but that doesn't tell us about the client's level of difficulties in noise. You can have two patients with the same audiogram who do very differently in the real world. So by including the result from the ACT test, you'll be getting valuable objective information about that client's real world ability to hear a noise that you didn't have before. This can help you as the clinician provide better counseling and also setting expectations regarding the outcome of the hearing aid fitting and whatever technology level the client wants to choose. The result of the ACT test then can also help support your recommendation for a higher level of technology when the clients have a higher level of need for help in the noise, as well as maybe recommending things like a TV adapter or a remote microphone like an EduMic. Now, from a business point of view, including ACT in your testing with practically every client elevates your professionalism and truly differentiates your business from your competitors. Okay, for you, Linda, question number 4. How does the ACT value affect the fitting in Genie?
Well, after performing the ACT test with your patient, you get the result as a number. The patient ACT value can range from -4 to 16, which is described by one of four severity categories: normal, mild, moderate, and severe compared to the normal data. I need to clarify that these categories are not the same as the categories of the hearing loss in the audiogram. A higher add value means the patients will need more support from the hearing aid to effectively hear speech in noise. Now, when fitting Oticon Real and Intent instrument, instead of addressing the personalization questions as we used to do before, the add value can be entered into Genie 2 and will automatically impact the settings in more sound intelligence to better support the patient's ability to hear in difficult or noise environment. As you can see on the slides, all these controls in Gini for real and intent fittings are affected by the act value. When using the act value in the fitting, it is expected that about 50% of hearing aid users will receive a different, more sound intelligence settings than default, giving a better starting point for the fitting.
So does this mean, Linda, that the ACT value is really limited to just helping with real and intent fittings?
No, not at all. No matter what hearing instruments you might recommend, you can use the ACT value as a starting point to address your patient's complaint in an objective way, and also show the value of your professional knowledge. Okay, 5 questions. Last question for you. What do our customers need to get started, and do you have any tips for the clients?
Sure. Well, the ACT software is available in a number of audiometers. First, it came out of the Interacoustics Affinity Compact audiometer with the AC440 module, the audiometer module, with now, of course, the ACT software included. Interacoustics will add the option of the ACT test to their Callista audiometer in the beginning of 2025. So if you have a Callista, then you can consider adding it then as well. You can also find the ACT test in many audiometers from the Medrex company, their Avant audiometers. And since the ACT test is compatible with your standard headphones or insert phones or your circumoral headphones you have at the office, you don't need any extra equipment and there's no extra calibration. Now, the best tip that we've heard from our customers who've been using the test is that it's very important to familiarize your client with the sounds they're listening for. Because as we've said, unlike a threshold test, the ACT test is not silent in the background. So the test comes with very easy, specific instructions, as well as examples of the background pink noise and the siren-like target signal, so the client can really be ready to know what they're listening for before you start the test. I just want to mention that we have a link here, if you notice it in the slide, that Interacoustics Academy has some great learnings about ACT, different levels and different depths of information. We also have an Oticon 2-page fitting guide with using the ACT in your fittings. And there's a very readable white paper from Oticon called Fitting and Counseling with Audible Contrast Threshold.
Okay, thank you, Maureen.
Thank you, Linda.
And thank you for watching our first 5 questions with Linda and Maureen. Our next video topic will be the new counseling tool. See you next time. Bye.
Bye.